The top 10 bizarre medical anomalies. Number 10, diprosopus, sometimes called craniofacial duplication, is a rare disorder in which the face is duplicated on the head. This is not to be confused with fetus in fetu. Number 9, which is a joining of two separate fetuses. Diprosopus is caused by a protein called, believe it or not, sonic hedgehog homolog. The odd name of is due to controversial tradition in molecular biology to use unusual names for genes. The protein determines the makeup of the face, and when there is too much of it, you get a second face in a mirror image. If you do not have enough of the protein, you can end up with underdeveloped facial features. Children with this defect are normally stillborn, but a girl, Lali Singh, born in 2008, survived for 2 full months before dying of a heart attack. Number 9, fetus in fetu. The most famous recent case of fetus in fetu was Sanju Bhagat, 36-year-old from India. He became fully pregnant with his own twin because Sanju lacked a placenta. The fetus inside him attached directly to his blood supply. Doctors believed the twin, which was severely malformed and did not survive. Fetus in fetu is an extremely rare disorder in which a twin somehow becomes connected internally or partly externally to its twin while still in the mother's womb. In some cases, the fetus in fetu will remain unknown inside the host twin until it begins to cause problems. In some common cases, the signs are visible from the outset and rare, often initially confused with the cysts or cancers. Number 8, Proteus syndrome. The elephant man Joseph Merrick is the most famous case of Proteus syndrome. The disease causes excessive bone and skin growth and frequently comes with tumors. Only 200 cases have been confirmed worldwide since the disease was officially discovered in 1979. It is possible to have a minor form of this disease which can go undiagnosed. The case of the elephant man has been the sole reason that this disease is so widely known. Sufferers have normal brain function and intelligence. Mobius syndrome. Mobius syndrome is a rare disorder in which the facial muscles are paralyzed. In most cases, the eyes are also unable to move from side to side. The disease prevents a sufferer from having any facial expressions, which can make them appear to be uninterrupted, uninterested, or dull, sometimes leading people to think they are rude. Sufferers have completely normal mental development. The causes are not fully understood, and there is no treatment aside from addressing the symptoms, such as an inability to feed as a baby. Number 6, Hutchinson Gilford progeria syndrome. Hutchinson Gilford progeria syndrome will be familiar to people old enough to remember the television program That's Incredible from the 80s, in which a young sufferer of the disorder appeared. The disease causes premature aging so rapidly that a young child can look like a very old person. The disease is especially interesting for scientists as it may lend clues to the natural aging process in him. The disease is caused by a genetic mutation and does not pass from parent to child. There is no known cure, and most children with the disease do not live beyond the age of 13, usually dying of stroke or heart attack. Number 5, cutaneous porphyria. Cutaneous porphyria is a disorder that causes blisters, excess hair, swelling, and rotting of the skin. It can cause red colored teeth and fingernails, and after exposure to sun, urine can turn purple, pink, brown, or black. The disease is thought to be connected to the many werewolf and vampire legends of the past, where a sufferer who would have lived hidden away from the society might have been confused for a monster. The disease is part of the more general group of disorders called porphyrias, which cover a range of mental and physical disorders due to the overproduction of certain enzymes in the body. The disease gets its name from the Greek word porphyra, meaning purple pigment. Then number 4, elephantiasis. First of all, note the spelling. It is elephantiasis, not elephantis. It is, as many people wrongly think, elephantiasis is a thickening of the skin as opposed to Proteus syndrome, which is thickening of the bones as well as the skin. Unfortunately, this is a disease any of us can get, as it is caused by parasitic worms passed on through mosquito bites. It is consequentially not uncommon in tropical regions and in Africa. A slightly different form of the disease is caused through contact with certain types of soil. In some parts of Ethiopia, up to 6% of the population suffers from the disorder. It is one of the most common disabilities in the world. Efforts to eradicate the disease are well underway, and it is hoped that it will be successfully relegated to the annals of history by 2020. The number 3, fibrodysplasia ossificans progressiva. FOP short form. FOP is a very rare disease that causes parts of the body, muscles, tendons, and ligaments to turn to bone when they are damaged. This can often cause damaged joints to fuse together, preventing movement. Unfortunately, surgical removal of the bone growths is ineffective as the body heals itself by recreating the removal bone. To make matters worse, the disease is so rare that it is often misdiagnosed as cancer, leading doctors to perform biopsies, which can spark worse growth of these bone like lumps. The most famous case is Harry Eastlack, whose body was so ossified by his death and he could only move his lips. His skeleton is now on display at the Mutter Museum. There is no cure. The number 2, Lewandowski Lud's dysplasia. Lewandowski Lud's dysplasia, also known as dysplasia vericiformis, is an extremely rare inheritable disorder in which masses of warts form on the skin. It normally affects the hands and feet, and while it can start in middle age, it normally begins between the age of 1 and 20. It, there is no known effective treatment for the disease, though surgery can be used or to remove the warts. Unfortunately, after surgery, the warts begin to return, and it is estimated that a sufferer would need at least 2 surgeries as per year to remove the warts each time they grow back. In 2007, a sufferer had surgery for the disease, and 95%, 13 pounds in this case, of warts were removed. The last one, number 1, diphalia. Diphalia, also known as penile duplication, is a condition in which a male is born with 2 penises. It is a rare disorder with only 1000 cases recorded. Sufferers are also at a higher risk of spina bifida than men with 1 penis. A person with diphalia can urinate from one or both of his penises. In most cases, both penises are side by side and the same size, but occasionally, in one smaller penis will sit atop another larger one. 1 in 5.5 million men in the United States have 2 penises.